Hello and welcome. Thank you for joining us for MESA Week. Today is the first day of our event, so we're so excited to have you all here. The theme for today is appropriately enough healthcare, and we have some great healthcare experts here to share with you. Our first session of the day is career insights, so we're happy that you've been able to join us. My name's Josh. I'm the MESA host for all of today's activities. We're going to start this session with a brief introduction from our speakers and follow up with a Q&A moderated by our colleague Julia, and then we'll finish with questions from the moderator and the audience. A couple of housekeeping items before we get started. For those of you who are new to Big Marker, we have turned off video features to protect your privacy. However, you can send us questions through the Q&A tab on the right-hand side of your screen, and we encourage you to do so. We may not be able to get to every question, so please upvote your favorite questions to make sure that we answer the ones that are most interesting to you. Second, please be mindful of our privacy policy on our homepage and don't post anything inappropriate or you'll be removed from the session. Throughout the session, please post your questions in the Q&A tab and we will ask them at the end. Please feel free to tag us in photos and videos using our handle @OregonMesa or on Facebook.com. At the end of the week, we'll share our favorite photos and videos during our award ceremony. Tune in at 3 p.m. on Thursday. Seniors, be sure to join us at 2 p.m. on Thursday for a special graduation ceremony. Stick around until the end of this presentation to complete a feedback form about your experience, and you will be entered to win a Smart Circuits Games and Gadgets Electronics Lab. We'll announce the winners of our session on Thursday during our end of week ceremony. I'd like to kick it over to our moderator, Julia, at this time. Thank you all so much for joining.
Awesome. Thank you, Josh. And thank you all for being here today. Again, my name is Julia Soto. I work for a nonprofit called Portland Workforce Alliance, or PWA. We work behind the scenes with your schools and local industries and businesses to bring students career learning opportunities like this one today. Today, I'm so excited to welcome Ton and Dr. Maxine Dexter to share their insights about healthcare careers. So let's jump right in. I'm going to go ahead and start with V. V, would you please tell us a little bit about yourself and what you do as a recruiter for the Multnomah County Health Department?
Hi, yes, thank you everybody for having me here. I'm extremely excited to share a little information about myself and for the organization that I work with, which is the Multnomah County Health Department. So I was born and raised in Portland, Oregon, lived here all my life and attended Portland Public Schools. I went to Benson High School and was in the HOSA program thinking that I would be a nurse. But as I got older and went to school, I realized that wasn't necessarily what I wanted to be, but I still wanted to be aligned with healthcare. As a recruiter, I work specifically with hiring managers to fill our positions that provide indirect and direct services to the county. What I do is I support them in the recruitment process, which could be from screening minimum qualifications, making sure our applicants have the specific certifications and licensure, and then also educating the community about all of the services that we have. Growing up, I used a lot of county services that I didn't know came from the health department. And so now as an adult and being on the other side, it's nice to connect the dots and realize some of the things that I and my family utilize was something that the health department has, and being able to give back to the community in that way. As a recruiter, I travel locally around the community to talk to students in school programs, in community-based platforms, and then as well as travel nationwide to do the same. The goal at the Multnomah County Health Department, as well as the whole entire county, is to diversify our workforce. Mainly is for me to go out to the community and bringing in individuals like you in the future, your family, your friends into the county, to provide that resource to the county, because for most of you out there, you are using the services from the county. And what better way to bring those into the workforce is those that are actually using the services. So I'm hoping to provide as more information and resources as I can and answer any questions you might have. And again, thank you for having me. And I hope you guys are all taking care of yourself and being safe.
Awesome. Thank you, V. Thanks for being here. Maxine, you see healthcare in a different way as a physician and pulmonologist. I'd love to hear more about your role in healthcare and how you came to study and practice medicine.
Great. Thank you so much. It's really exciting to be here and to be able to connect with everyone. So I am a pulmonary and critical care doctor, which means that I take care of patients who have lung problems, as well as patients who are in our intensive care units on life support. And so they are the sickest patients. And so usually I go down into the emergency room to see patients and then help stabilize them and bring them up to the intensive care unit where we take care of them until they're stable enough to leave. So I grew up in a very small town that used to be an independent town, now I think is a suburb of Seattle. And I was the only person in my family who had ever wanted to go to college, and that wouldn't have ever even crossed my mind if a fifth grade teacher hadn't told me what it was. We actually grew up with no books in our house, and really it wasn't even a reality that there was such a thing as trying to go to school. So it was remarkable to have a public school system that kind of helped support my interests, and science classes became where I wanted to spend all my time. And then as I moved forward, I never looked back. And so I really am grateful for the public education I got, and then being able to pay my way through a state school. So I very much appreciate the challenges that some people have to getting into medicine. And please, like, if you're interested, never ever take no for an answer, just keep on trucking. So I now work at Kaiser Permanente as a pulmonary and critical care doctor, and I think we'll get more into this, but right now is a really interesting time to be doing that because we are taking care of patients in our COVID units. And so I'm happy to take questions about that later on too. So thanks for having me.
Yeah, thank you. And I guess just to stay with you for a minute on that topic, Maxine, just wondering a little bit more, you know, as you mentioned, our healthcare professionals are really the focus of a lot of our attention right now as you are caring for many COVID patients. I'm really curious how your work has changed. What does it look like for you right now? And what are we not hearing about healthcare on the front lines that you can share?
Yeah, you know, we were always busy before COVID, and so I think I'll get into what that is because I know that that's where a lot of the interest is. But I will say the thing that people don't hear right now is all the folks who are sick who don't have access to healthcare in the same way that they are used to. So I take care of patients with new diagnoses of lung cancer and different kinds of really serious infections, and they are afraid to come in. And so we're seeing people coming in later and sicker than we used to. And people, you know, in general, aren't hearing about the downsides of having everything kind of shut down right now. And so in healthcare, you would think that we're all invested in making sure that we are taking care of everyone, and that is very true, but we're also trying to keep people safe by keeping them out of the clinics and the hospitals, and so that's delaying some of the care that normally we would be doing. But as far as the COVID unit, like we had our first patient at our Westside Medical Center, which is out in Hillsborough, late in February, and it was my partners who diagnosed it. And you know, we had been thinking about it, and I had actually just been posting some things the day prior saying that we needed to get ready for it. And suddenly we had it, and it was this crazy, emotional, challenging time trying to figure out how we kept everyone safe and how we did the right thing for patients. And so pretty quickly we switched to having a system where we assumed some patients had COVID-19, and so we were wearing those PAPR hoods that you hear. Those are personal respiratory devices that allow you to breathe within a mask so you're not exposed to droplets. And we had, you know, a lot of challenges trying to make sure that we had enough of those because our system wasn't really ready for that. So you've heard a lot about the personal protective equipment. That's been a huge challenge for us all along, is trying to make sure we had everything we needed to be able to have our healthcare providers take care of patients. And then as we had more and more patients, we moved to a negative pressure whole unit. So everyone in that unit wears them, not just when you go into the room, but just walking around. And it's been an emotional time because we have patients who are in the hospital who don't get to have their families with them. And that, as a healthcare provider, has been really hard because a lot of what you do in a day, especially as an intensive care unit doctor, is help the people at the bedside know what's happening, because your patients don't have good memories. They're so sick and they're on medicines that kind of take that away, that they wake up confused and wanting to know where they are. And so the people at the bedside who love them and are there all the day long can help kind of reorient them and let them know what's happening. And when they're in these isolated rooms, it's scary for patients, and it's hard for us because we can't be at the bedside every moment. And so this has been a really challenging time, and yet because of the things that you all are doing, staying home and making sure that you're not going out into public more than you have to, we really have been able to decrease the number of cases. And so now my life is almost back to normal because there are so few people in the hospital with COVID. So it's been, just a rapid transition thanks to the work that everyone's doing in Oregon.
Yeah, thank you for sharing. And I really appreciate that. And we will continue to try to do all we can so that your safety and your colleagues' safety doesn't need to be continued to be compromised. And I think on that note, speaking of how we can all be safe, I'm curious to hear a little bit more from V, to hear about the county and the types of health services that you provide, and maybe how is that changing at all during this COVID crisis?
I think I echo a lot of what Maxine was talking about, of everybody staying safe and about the conversation about having enough and appropriate PPE for everybody. As Dr. Dexter or Maxine was talking, our role has shifted. We are always busy before, but we are busier because right now we're responding to COVID-19 by opening up the shelters throughout the Portland metro area for our homeless population, for them to stay home, have a place to stay, food, lodging for them to sleep, and providing healthcare services for them. And so the county has been very busy staffing and setting up the shelters to provide that service. And so since March, I have some statistics here that, so we have an emergency operations center, which we call the EOC, and they've worked with the Joint Office of Homeless Services, and we opened about 450 shelter beds. And we've been hiring those from the community to come in and help provide all of these services to our homeless population. We've consolidated some of our clinics just so that way we can stay focused and providing care versus having everybody spread out to help with kind of the COVID-19 response. And so I wanted to quickly just kind of talk about what opportunities we have at the county and what their roles are within the county. And perhaps this will pave some spark for those of you that aren't too sure about doing healthcare or wanting to be in healthcare, understand what the county provides and what positions we have here at the county. So I wanted, if that's okay for me to, oh, there you go, sorry. So for the county services, so at the health department, I just wanted to highlight some of the areas we have. We have the medical and dental clinic services. We have a correctional jail, which house and provide medical services to 3 county jail facilities. So it's 2 adult facilities and 1 juvenile facility. We also have a division that's focusedly based on mental health services to adults, children, and families. We have a public health division that has inspections, which are food inspectors that are going out to the restaurants, which right now most of the restaurants are closed or doing takeout and delivery only. Our health inspectors will go out and make sure that the food is prepared and provided safely to the community. We do licensing, medical records, and that could be birth certificates, death certificates. We do prevention regarding a lead, prevention and testing as well. We have an STD, HIV clinic, vector control, which is kind of something that I never knew the health department did. And what that is that we provide education and preventative measures for our mosquitoes, our rats, and our bed bugs throughout the community. So we have individuals hired to go around spraying to control a lot of these pest issues that we have in the county. Medical examiner's office is something that we have been exposed into the media, where if there is some type of accident where there's a fatality, our staff are the ones that go out and do an investigation. They bring the deceased back into the office and do an investigation to see, what are the cause of death. And so that, for those that are interested in the public health, criminal justice side, that's an area where you would want to explore as a medical examiner's office. They work 24/7 and they're very dedicated in providing information alongside with our prosecuting offices, district attorney's office, and the sheriff's office in the community. And then the emergency preparedness is, again, the EOC, which they're right now responding to COVID-19. So what is it that they need to do to protect the community? Who do they need to talk to? Who do they need to work with? And how do they provide update real information for the community so that they can understand what's going on? And then I just wanted to quickly kind of list on the slide is the other county departments. The county is just not the health department. We are a very big entity and we have different departments that specializes and do things specifically for the community. And as I've listed, we have an animal shelter. We maintain all the bridges and the road signs, all the road signs that you're out there when you're driving around, that's maintained by Multnomah County. I've already talked about the district attorney's office, but we handle criminal cases as well as domestic violence and child support. Elections is something that we're all working on recently. And so we do that locally and we do that nationwide. And marriage license, one of our buildings, you see people coming in celebrating their marriage. And then we've got people coming in paying their property taxes. So there's an array of different county resources that we provide along with, the things that are provided by the health department. But again, for the justice side, we have the parole and probation and then the sheriff's office. So that's kind of a quick snapshot of what the health department does and the rest of the county, but we do partner with all of our community partners with providing these services to the county.
Thank you, V. It's really helpful to hear that context and to know how many services are out there. I think that's one of the things that we wanted to make known to all of our participants here today, is kind of talking about what's out there in the community. And along with that is sort of the calling to serve as well. So I wanted to bounce back over to Maxine and ask you a little bit more about your calling, because we often talk about that role to become a doctor as a calling, because it is hard work and it is emotional work. So I'm curious to hear a little bit about how your training and role as a doctor also translates to you advocating for your community.
Great. So I think, the calling part was something that I felt really early on. My grandmother had diabetes and had a lot of complications of diabetes. She had lost part of her feet and had a lot of wounds that weren't healing and was on dialysis, and she needed to live with us. And so I was the only person in my family who wasn't kind of grossed out by changing her bandages and taking care of her. So I started going to visits to her doctor with her. And it was really there where I saw how fond she was of her doctor, how much they were able to help her. And so then when my teacher in 5th grade said that you can be a doctor, it seemed like this unreal thing that someone just was a doctor. I didn't realize that I could be one. And so when that happened, it was like a light clicked, and that was clearly what I wanted. So I think it was that juxtaposition of a person in my life who really had people that she looked up to and was being cared for that were physicians, and then this opportunity that I realized I had that I didn't know. So that's where the calling came from. Throughout, I really feel a lot of gratitude for being in this position. My family is a working family. We are really struggling. My nieces and nephews, no one else still has gone to college. And so I've always felt like I need to help make opportunity for others, who are equally or worse off. And we don't do a good job in our community making sure that all those doors are open for everyone equitably. So why now I'm trying to leverage my background as a physician with the community is actually as an elected official. And so I am running for office now because I believe we need to create equitable systems and really build better bridges for everyone to have access to the, higher education, but also good healthcare and good education. So, I think being a physician is rewarding and amazing, and I love my job. And it's a person by person, day by day impact. And I just really feel like I have to make a bigger impact because so many people are struggling and suffering right now. And we really are seeing that even more so with COVID-19. So it's this crazy reality that we're in, that I was already running for office, and now, you know, I've had a lot of opportunity to speak to this healthcare perspective that I think is really important on a lot of people's minds right now.
I really appreciate that. I also can see that we're getting a lot of great questions in the chat from students. So I want to ask one more brief question of V before we turn it over to some questions. And speaking about community health, you know, a lot of the work that we do is informed by who we are as a person. So I'm curious to hear from you, V, when you think of community, what inspires and motivates you to care and want to work towards our community's health?
Well, I think earlier I mentioned that, you know, I grew up in Portland and was using resources from the county that I didn't know. And now, as being a professional in the healthcare field for the health department, I'm able to connect all of that and all those resources that I use. And I want to educate, and I want to share those resources with everyone else in the community. And, you know, Maxine talked about the disparity of resources, and I completely understand. And that's part of what my drive is at the health department. It's not me as a recruiter just filling positions, is me educating what the county does and where individuals can get resources. And that is the thing that's important, because, you know, if we don't ask questions, if we can't make the assumption that people know where to go for these resources. And so it's my job to go out there and advocate for that. It's my job to go cheerlead for the county and say, hey, you know, did you know that, you know, the student healthcare service centers provide more than just, you know, a nurse, you know, checking out your wound if you fell, you know, outside. It's more than that. And so as I'm working on the information, and I have slides to share, there are many opportunities for you to be part of the healthcare system at the county. And as a recruiter, I want to provide those resources. And so I'm going to just click on some of the slides that I have. I don't have all the time to share all of it, but I wanted to at least provide the disparities data that we've collected for novel coronavirus 19. There's a link there that you could jump on, and we've created a dashboard where we're collecting information about where in the community we see people are getting COVID. Where deaths that has been happening in the Multnomah County. So I recommend, just to stay on top of things real live, I have our team updating this website. In addition to that, you know, mental health is a very important thing more recently. And so if you don't know where to go, this is where a good start would be. You know, we have people that is on the phone 24/7, providing resources, listening, just for an outlet if anybody needs to talk. Staying at home is hard. Staying at home with a large number of people in the family in a small home is hard. And so anytime that you need somebody to talk to, don't be shy, don't be scared. This is where you could go to get some help. And we do it with, you know, interpretation services. So if English is not your first language, that's okay. We do have interpretation services, so it's there for you to use. Student health centers I've talked about, these are the things that we provide at the student health centers. So when you have a moment, I would take a look and visit our website to get more information. I know schools are out in session right now, but in the future, as we go back, these are some services that you can definitely take advantage of and explore. And then for career-wise, there are many different opportunities in healthcare. And so just healthcare and administrative and finance, human resources, which I didn't really think about the county having HR positions. As I went to school, I thought it was just nurses, physicians, pharmacists, but as I am here, I'm understanding more about the work that we can do. And so a lot of students, when they come to me and they go, what positions do you have? These are the things that I can talk about. So for those that are exploring business management, we have a place for you. And so those are just kind of some examples about, you know, where we can have. And I think in terms of me advocating and providing more information about the county, We have some programs that the county has either developed or worked with community partners. And it is an application process, so more information could be provided on these websites. So I recommend that you click on information and see if you're interested. I've left contact information as well, but the Multnomah Youth Commission is for ages 13 to 21, and it's basically a platform for young people to advocate and talk about policy work and how things are impacted in the community. Summer Works is a program from 16 to 24, and so these are opportunities where the students can come in and work alongside with our professionals. And typically it's summer, but there is all year round opportunity as well. You can earn high school credit. And so we've hired actually regular status employees after they graduate high school into our regular positions. And so they get the opportunity to continue providing support and resources to the community. And then we've got the College to County mentorship program. And this is a great opportunity for college students to work with the county, just like as high school students in the Summer Works program. But it's a paid internship. It's an opportunity for you to kind of figure out what you want to do as you step into into college, if that's where you're going, or you're deciding to go to the trade school. This is a great program that I highly recommend you reaching out to. And Teresa Kelly, I've already spoke to her. I did let her know that I will be sharing this information, and she might have an uptick of people reaching out to her to get more information. So in any of these programs, if you have any questions, please feel free to reach out to me directly, and I'll do my best to provide information. But I think my work is to really share information and educate the community about what opportunities they have here at the community and how to give back to the community.
That's fantastic. Thanks, Vee, for all those great resources. That was actually one of the questions that we were getting, is what availability are there for internships and volunteering and early jobs? And I think the county and your partnership with Summer Works and many other programs helps that. I'm curious, Maxine, if you're aware of any opportunities for students through Kaiser. I know Kaiser has a couple programs. Are you able to share or talk about that at all?
Yeah, I don't have the links, but if you want to share my email, I'm happy for people to reach out to me and I can put them into contact. Unfortunately, with COVID-19, a lot of the resources or the internships that we normally have kind of gone into a sort of a pause mode. We definitely, for students who are 16 and older, we have the ability for students to come and shadow and do different kind of student, I wouldn't say that you're necessarily shadowing the same person, but shadowing in your area of interest. And so it does require some time, though, because you have to have a lot of different vaccinations and things. So it's something that you should plan ahead for, and reaching out now would be very reasonable, because we can kind of facilitate helping along those lines. And then we have a lot of other school-based programs that if there are schools that are interested in getting connected with us, like I work at Fabian Middle School as a mentor for students who are interested in healthcare careers, and we have a really great whole 6-month program that's called the Hippocrates Circle that tries to help facilitate kids who are interested in healthcare careers getting into those. And then there's scholarships and things as you graduate from high school. So if there's a group of students from a school who are really interested, especially in underprivileged communities who don't have all of the resources that maybe some of our other schools do, we really want to help. So let me know, and I'll put people into contact with our coordinator at Kaiser Northwest.
Sounds great. I am blown away by how many amazing questions that we have, and we just simply do not have all the time to get to all of them. But I wanted to give you guys just maybe like a quick 30 seconds just to talk about your work-life balance. Another question that got a lot of votes is talking about flexibility in your job to spend time with family and friends. I think that is so pertinent right now, especially as we want to make sure everyone's taking care of themselves as they're taking care of others. So I'm curious for you, Maxine, especially in a grueling job like a physician, what kind of flexibility do you have? And I know right now is kind of an extraordinary time, so maybe speaking more generally.
Yeah, no, I honestly, critical care and pulmonology has been amazing. You never have the same thing happening twice, and I really have shift-based work in the ICU that you can work around a schedule, and also clinic-based that is pretty flexible. So we have, most of us are full-time, but like if I get elected, I'll be part-time, and that certainly allows for flexibility. In general internal medicine and family practice and pediatrics in particular, most people are part-time. So definitely work-life balance is possible. And, you know, you make enough money that you should be able to do just fine on part-time. So I think that it really allows for physicians to have time with their families and also serve their communities. I couldn't recommend it more highly. I love my job.
It's great, and it shows. And V, what about you? How do you, real quick, maybe like in 20 seconds, because we're running out of time. There's not much time.
Yeah, so I've been blessed and able to telework from home since beginning of March. Most of my work is done remotely through our systems, and we have our VPN set up. So when I'm scheduling interviews, when I'm meetings with my colleagues and with my leadership, I'm able to do it from the comfort of my own home. I try to do the work-life balance as much as I can. I have a daughter who's 4 that's at home full-time. And so Julia, you've met her through one of our video chats before. And so I have to make sure that I balance my work. There are days that I work a lot more hours than I normally do, is because I'm providing a service to the community, and we're not pausing because the community needs us. So I'm trying to balance that. But things have stabilized because you guys are all staying home, doing a great job, staying safe and staying healthy. It makes our job a lot easier. We're not having to respond in a crisis mode, even though we are kind of in a global pandemic. But yeah, the life balance is, you know, I love my family, I love my friends, I'm taking care of myself, but I'm doing the work that matters to me. I love it. And so healthcare is a great field to be in. And any questions about healthcare, please feel free to reach out to me personally. But yeah, go for walks.
Go for walks. Well, thank you both. Thank you both so much for your time today. I want to send it back over to Josh to wrap up. But again, I really appreciate you all being here and sharing your insights with us.
Thank you.
Thank you so much. That concludes our presentation for our career insights into healthcare. A couple of notes before we leave for today. First and foremost, thank you so much to Julia, V, and Maxine for their time today. I really appreciate your insights. Students, please stick around to fill out a survey. You should have had a pop-up on your screen moments ago offering you to fill out a survey. Students who complete that survey are going to be entered to win a Smart Circuits Games and Gadgets Electronics Lab. We'll announce the winners of our session on Thursday during the end of week ceremony. We're going to begin our next session, which is College Hangout at 1:45. We so hope to see you there. Thank you, everyone.
Thank you so much. Good luck to everybody.
Thank you, and take care.